Well, we decided to bring this issue forward this year, the importance of maternal mortality and newborns, because the world has made so much progress on under 5 deaths of children, but yet that first 30 days of life, and in fact, the first day a baby is born, is the most dangerous day for the baby. And we're still losing 800 moms a day to maternal mortality. So we looked at the data from around the world. We have a number of researchers. One of them is Institute for Health Metrics. And we said, this is data that people need to understand so that the world can do something about it.
According to the report, the world has the tools and innovations to prevent maternal and childhood death. Yet these innovations are not reaching everyone. What are some of them?
Well, some of the innovations that we highlight are things like intravenous iron. There's a doctor in Nigeria who has come up with a way to do IV iron, which only takes 15 minutes for an infusion. And what we know is that it makes a woman less likely to hemorrhage during childbirth. That's a fantastic innovation that should be scaled up immediately. Azithromycin, which is a very common drug, something a lot of us use even if we get some other infection. It's low cost. It could be given to moms to prevent sepsis at the birth of a child. We highlighted one other thing in the report. We highlight 7 interventions, but another one is a very simple drape, a surgical drape that put under the mom right after childbirth that it's called emotive, that can literally measure how much blood a mom is putting out or hemorrhaging from to know whether the doctor or the obstetrician needs to intervene right then. So we look at these key interventions that can bring down the most death in women, and we make sure that all of them are ones that can easily be used in low and middle income settings.
And what can countries do to ensure that women in the most remote places have access to the care they need and to new innovations?
Well, several things that countries can do. One is they can make sure that there are enough midwives in the country that are well trained. They can look at their regulations to make sure that these innovations as they come out, this one that's coming out from Nigeria on intravenous iron, that it doesn't necessarily have to be a doctor that gives it, that it can be a nurse or a midwife who can give it. So changing the regulation of who along the chain can actually do the intervention, that's another important thing that can be done. Making sure that women not only know they need to get to the healthcare facility before they enter labor, but making sure the community knows and makes a plan for that. I've seen that done in Malawi, and it's made a huge difference that women get to the healthcare center early. They can learn about other things that can help their children and their babies, but then they're not caught in a rainstorm where there's no motorcycle available to take them. That's when they get in trouble in terms of the delivery.
Looking at the state of the world currently, we see that the world is confronted with many urgencies such as climate change, COVID, conflicts. How should maternal health and infant mortality remain a priority on the agenda for world leaders?
Well, this is exactly why we're putting the Goalkeepers report out, is to remind world leaders this is incredibly important. You can't have, these other conflicts or these other issues taking away from this issue. If we invest in moms and babies, moms are the fabric of society. They are the person in the household who decides who eats and in what order and what's fed to the children. They are the ones when the children are sick that take them to the health clinic. And if a baby grows up healthy, he or she are then able to go to school. And guess what? They then get a good job in the informal or the formal sector, and they contribute to the economy. So a mom is not only the center of the family, she's the center of the community and ultimately the center of the economy. And so prime ministers and presidents realizing that investing in moms and babies is a good investment for their country overall is something we need to keep highlighting for the world.
You are very passionate about maternal health and childhood survival. The Gates Foundation has been doing this work for many years. For you, Melinda French Gates, what makes you wake up every day and still work to address these issues?
Well, I'm a new grandmother. So I have a 6-month baby granddaughter. I was there with my daughter and her husband at the birth of that grandchild. And Look, I've given birth to 3 children myself. I know how scary that day is, and I've been in many labor and delivery wards around the world. And I just know that I want the world to be a better place for my granddaughter. And I see that we've made huge progress in under 5 deaths of children in the world. So I know progress is possible. But I don't want to leave behind a world where this many moms and babies are dying. And I want to make sure the girls have amazing opportunities in the world. Girls have so much to contribute. I don't care where you live. And I want to make sure that we make that easier as a world for my granddaughter and hopefully my other future grandchildren.
Now, coming back to the SDGs, we are less than 10 years to 2030. How optimistic are you about 2030 when it comes to achieving goal number 3 on health, particularly regarding maternal health and infant mortality?
Well, I think, let's be honest, the pandemic set us back. We've seen maternal mortality rise in places. We've seen underchild deaths not being addressed because the health systems are fragile. They were already fragile, but then you put the pandemic on top. But what we're showing this year in the Goalkeepers report is we actually know how to save 2 million lives between now and 2030. So the 7 interventions that we talk about in this report, azithromycin, IV iron, a simple way of measuring hemorrhaging, a new ultrasound, a tiny little one that's coming out, these interventions can help save 2 million lives between now and 2030. So we want people to know, just like bringing down under 5 childhood deaths, I go like this because it was a graph of all those deaths coming down, it is possible to save these lives between now and 2030. And I think that progress will give the world more momentum to know we can save children's lives, and we need forward progress on this.
So what is your message or the main takeaway regarding the Goalkeepers Report 2023?
800 women should not die a day in childbirth. We can address this. We know how to address it. And we don't need so many babies to die on their first day of life. We as a world know how to save these lives. And guess what? Every life is important and it's worth saving.
This is the 7th Goalkeepers Report. Where have you seen the most progress and where do you think a lot more needs to be done?
Well, we saw amazing progress on reduction in poverty. We saw amazing progress on reduction in under 5 deaths, age 5 deaths for children. Now, the pandemic set us back, and we have to be honest about that. It wasn't something anybody in the world was expecting, but we're starting to see people, are definitely going back to the health system. We're seeing the health systems revitalize. So progress is possible. I worry the most, quite frankly, about gender equality. I see all over the world that places have made excuses and set gender equality back instead of the forward momentum, and that's the one that worries me the most.
Melinda French Gates, thank you so much. We appreciate your time.
Thanks for your time, Linord.